Live from Wave in Louisville, Kentucky. This is Listens Live.
Welcome into a Thursday edition of Wave Listens Live. I'm Michael Vanover in for Brian Schlonsky today. It is Thursday and we have a great show planned for you. As always, let's get right on it and look at the rundown of who's coming on today. We're going to have our friends from Rev Body Sculpting. Amy is going to be joining us here in just a little bit. We look forward to talking to her as we always do. But first joining us is Doctor Ajith Nair from Kentuckiana Pain Specialist, who's joining me now. Dr. Nair, welcome into the show. Thanks for being here. I really appreciate it.
Thank you, Michael, for having me here.
So I've seen you on TV before, okay? I see you out and about. You've got the face for sure, and you've been on our program before, so again, welcome back. But for the folks at home that are not familiar with Kentuckiana Pain Specialists, could you give us a little bit of background on exactly what you guys do?
Sure. Well, Kentuckiana Pain Specialists, we've been around for about 25 years, and we specialize in treating patients who have chronic intractable pain. Most of what we do, it's interventional. We tend to shy away from medication management, but we have very effective results in treating pain.
That's awesome. So a lot of options for a lot of people that really need it. You know,
That's correct.
So if you are suffering in any way, give them a call. The phone number there is at the bottom of your screen, and KentuckianaPainSpecialist.com. But we've got some good things to talk about today. Some words that I might mess up, but we're going to figure it out. You will help me through it, Dr. Nair. I know you will.
Absolutely.
So let's jump in and talk about stellate ganglion block. Did I get that right or close?
You did. Stellate ganglion block.
So talk about what that is and how exactly it works.
Well, first let's talk about conditions that are amenable to a stellate ganglion block. This injection has been used for many, many decades. It's primarily used to treat pain in the face area. It can be a result of post-zoster infection with residual pain. You can also have a condition called trigeminal neuralgia. But off late, we've seen good results with patients who have post-traumatic stress and with long-term COVID symptoms. Very often, patients who suffer from COVID, they tend to have residual abnormal smell and taste. And these injections actually help with this type of pain. The injection itself is a simple injection that's done on the right side of the neck. Okay. It's done under radiological guidance. It takes about maybe 5 minutes or less. And usually you see results within about 2 weeks to a month.
So it can help with, like, get rid of those smells for the post that you're talking about,
that's
or get rid of that's amazing.
Absolutely.
Yeah, that's great. And of course, pain and the post-traumatic stress. So that sounds like it really can work in a lot of different ways.
It can.
And a lot of people are suffering from that. So what are some other benefits of the treatment that you would say that people might, again, if they feel like I've tried everything and it's not working, what are some other benefits that they could expect?
From the stellate ganglion block? Well, keep in mind, I've seen a good number of patients who've had parosmia and dysgeusia, which is the abnormal smell and taste sensation, and their life is just devastated because they can neither eat, they can neither do any of their day-to-day activities, and it's very disabling.
And it can change quickly.
Yes, it can. And unfortunately, patients don't really know about this type of treatment option. It's not commonly known. So by the time they come to me, they've been suffering with this for about maybe over a year. Right. But it's effective, and I would strongly suggest patients research it and give our office a call.
So when you're evaluating a patient and you're looking at and listening to what they're suffering from and all that, how do you know if it's a good fit or not? What are some of the things that you really look for? Well,
first we look at what the condition is, and a thorough history examination, and I also look at what other treatments they've already completed and whether they've worked or not. Usually those patients who receive these type of injections are those who have failed conservative treatment options.
Okay. And what would you say if people watching right now that are like, oh, he's talking about me? What should people know before they potentially undergo this treatment? What is something they should know in advance of it?
Well, I would strongly suggest that they read about it. I mean, there's plenty of information online, and of course, come in, have a consultation with me, and I would walk them through the entire process. How it's performed, what are the risks, what are the benefits, and very often, sometimes patients may be a little bit nervous, and they can get some sedation prior to having the injection.
Now, some people might be wondering, how long does it take? What does the aftercare look like? Take me through that a little bit.
Well, the stellate ganglion blocks are fairly straightforward. After the injection, which takes about less than 5 minutes, the patients recover in the recovery room for about an hour. And then they get to go home and, they can do their day-to-day activities. activities. The stellate ganglion block, the intent is to try and reboot the nervous system so that it can, get back to its normal functioning. So that's the purpose of it.
Yeah, well, it sounds like it's working for people. What are some of the common things that you hear, obviously outside of maybe, hey, the smells back to normal or what have you? What are some of the other things that patients will tell you after they go through this?
Well, first of all, they say that they wish they knew about it earlier. Yeah. They also talk about the ability to get back to work, get back to enjoying their life, and not having to avoid certain situations where, having an audience with their family or going out in public places. That now becomes a hurdle if they have difficulty smelling and tasting.
Well, and you think about it, I think that's one of those things, and it happens, in our life all the time, that we take for granted.
Absolutely.
You take for granted being able to smell and being able to taste, and COVID kind of changed that. And so when you talk about that, I mean, it's got to be very rewarding for you, right, to really kind of give people a piece of their life back, so to speak, and not trying to make it a bigger deal than it is, because it is a big deal. I mean, what's that like for you? You've got to really enjoy being able to help people out that way.
Well, yes, it certainly is enjoyable to give patients their quality of life back, but these are things that I've learned through my training, and if I can use my training to help patients and help them get back on track, I'm more than glad to do that.
So, and if people watching right now that they're thinking that could be me, it could not be, what would your advice to them at home right now be as far as possibly coming in and setting up an appointment? What would you think is their best next steps?
I would say just pick up the phone, call my office, come in for a consultation, and let's go from there.
All right. Well, you see the information on the screen. Kentuckiana Pain Specialist, 502-995-4004, or online at KentuckianaPainSpecialist.com. We've got more with Dr. Nair when we come back to get to, so don't go anywhere on us. We're looking forward to that, and we'll be right back after these messages on Wave.
The Wave Charlie Wilson's Jen Air Kitchen is furnished by Miller's